Well, I think the board members that are here, so let's get the meeting started.
And if I find the agenda again.
Okay. Calling the meeting to order. If I could get an approval of the minutes from May 24th, they were in your packet. Hopefully we all had time to review those.
I'll make a motion.
Thank you, Jim. Second, please.
Let's
I
say
will.
We have a motion and a second. All in favor?
Aye.
All right, next up is the medical staff meeting summary. I do not see Dr. Markham in the building. So.
Yep, Dr. Markham's in the emergency room finishing up a patient from last night. So,
okay.
Medical staff met on June 14th, gave them some information from the CDC on COVID rebound after Paxlovid treatment. So just information for them to read about in their packets. Also gave them some information on monkeypox through the Iowa Department of Public Health. Haven't seen that here, but just again giving that information out to them. Went over the joint conference policies and procedures. Those were all approved by the medical staff. On our inpatient unit, we've been working have an entire team working on falls and preventing falls from patients when they're in the hospital. So this fall team, they do a thorough assessment of patients when they come in, and if they identify a patient as being at a very high risk for falling, what they've asked from the medical staff is a standing order for physical therapy to come in and evaluate those patients. So after discussion, the medical staff agreed that that sounded like a great idea, so they'll have a standing order that any patient who comes in at a very high risk of being a fall, potential for a fall, after evaluation, then PT will come in and evaluate and treat those patients. So they're very happy for that. Jason Eckerman, our lab director, came in and talked with the medical staff and did renew a 3-year contract with the American Red Cross to continue our blood from the American Red Cross. Nicole Olinger, our director of outpatient, came and talked to medical staff. Dr. Bays, our new neurologist, has started and is doing a great job. And what he's just kind of tweaking things as he comes in. And anytime a physician orders an EMG for Dr. Bays to complete, he also wants to have a consult at that same time.
What's an EMG?
Basically they hook up electrodes and then determine the nerve, like nerve conduction. So a lot of times they'll do that before like a carpal tunnel to see how the nerves are working through those areas. So that kind of describes it for you.
Yeah.
Okay. So anyway, so Dr. Bays wants to have, if he's doing an EMG, he also wants to consult with that patient to determine, what's going on and making sure that that's what needs to be happening with the patient. So just kind of reminding the medical staff of that. And then the last, we had Jenny Stewart and Suzanne Watson from Heartland Services. So this is a service that provides some mental health support to our patients who especially come to the emergency department with a crisis type of situation. In the past we used ITP, which was a telehealth service. They charged for those services, and Heartland Services is actually a free charge. It's paid for through state monies, and it's a regional resource for our patients. So they have a 24/7 therapist who, if a patient comes into the ER, they can do crisis, talking with the patient and getting them kind of through that crisis. The nice thing about the Heartland Services is that they provide 24 plus hours of follow-up after. So once the patient, if it's not a patient who needs to go into inpatient therapy, they can go home. They'll work with them on a safety plan with the patient. They'll have follow-up services, so they'll make sure they get into their appointments after that and really do a lot more follow-up with those patients. So we're pretty happy to be able to see that type of service. The only thing they don't provide that ITB did provide was some medication management, but we also have our behavioral health department that can help with some of that medication management. So
do they pass them on then after they're out of the ER?
yeah, right, yeah.
If
So
they're not seeing the service then?
yeah, so they can either get them into our behavioral health or any other services, or for like the medication management, they'll get them into our behavioral health and start working with that medication management. So it's a nice in between, plus a lot of follow-up that we're really excited to have. Any other questions?
Any questions? Okay, next is the quality improvement report. Laura?
Okay. Med-Surg monitored the prevention of pressure ulcers. They're also doing a focus study on reporting critical labs within 30 minutes of that, of receiving that lab, that they're reporting that to the provider. And as Karen had mentioned, they also started that new fall prevention program. So that's a great thing. Up in OB, they're evaluating documentation requirements in early elective deliveries prior to 39 weeks. They reported no early elective deliveries, which is what we want. The primary C-section rate was at 14%. The national rate for that is 16%, and we want to be below that. So that's moms having their first delivery as a C-section. They also reported a significant increase in breastfeeding from 47% to 78% for babies that getting primary. Yeah, so that was a huge improvement. Pharmacy reported no adverse drug events and no medication errors. Rehab completed a focus study on monitoring supply outdates and aquatic therapy pool maintenance. Respiratory therapy monitored therapy tests, patient satisfaction with the sleep studies, and also 2 patient identifications. Rural health clinics, of course, we were monitoring all of the ACO measures on that. Senior Life Solutions, they track anybody that misses 2 appointments within a 30-day period and then offer to meet with the program director through that, and they also monitor documentation accuracy. And utilization review evaluated the patients being admitted to a proper level of care as well as the length of stay, and both of those measures were at 99%. So, any questions at all? That's all I have.
Questions, anyone?
Thank you.
Thank you. Moving on, we're back to Karen.
All right. So we had a joint conference committee meeting May 3rd. I'll go ahead and pass around. This is all of the policies and procedures that were new and brought to the committee. So I'll pass those around for your review. So just a reminder with joint conference, so we have all of our departments divided up, and we have meet 4 times a year or quarterly. And the departments are divided up into those quarters. So then we review the entire policy and procedure manual for the departments for that quarter, and then any new policies or procedures since the last meeting. So for the quarter, for the entire policy and procedure manuals, we looked at, this starts on page 7 in your packets, admissions, cardiac rehab, diagnostic imaging, emergency department, environmental services, information services are inpatient unit, which they had a lot of policies, occupational health, outpatient department, perioperative department, public health, and purchasing. So those were the full policies and procedure manuals that we went through. And then I usually go in a little more detail on the new policies and procedures since the last meeting. So one of them was dietary, and they looked at their enteral nutrition, so basically that's liquid nutrition that we give our patients who maybe can't eat for some reason, and updated their information on the products that we provide in-house for those patients. Infection prevention, again, COVID, of course, is our biggest thing with infection prevention, just updates to the policies and procedures. And then for post-exposure prophylaxis for hepatitis B, no longer defining how to give the vaccine, just states per the manufacturer, which is a lot easier than trying to, each different vaccine has lots of different parameters around them, so we just go by the manufacturer's recommendations. OB Birthing Center, as Laura talked about, breast milk. We are a mother's milk bank of Iowa now, so mothers can come and donate their milk, basically breast milk, for any babies who want it. And then now we are also now a dispensary, so we can actually give that milk out as well after it's pasteurized. So it's been a new program that we've started. It's been well received. We have quite a few people depositing milk here, and then like I said, we just now started out a dispensary of that as well.
Do we pasteurize it here, or does it go somewhere?
No, it goes to I believe it's the University of Iowa, and they pasteurize it, and then it comes back to us. So let's see, and then swaddle bathing, did some revisions on that. They're waiting 24 hours before bathing those newborns after they're born. Do a lot of skin to skin now, and then they don't want to alter any of that bonding time with the mother, so they wait about 24 hours before doing that first swaddle bath. Respiratory therapy, they changed some of their call package for the weekends, and then their COVID-19 PFT testing. So when they do that testing, it's a lot of breathing in and out. So we had a lot of parameters around that during COVID, and they've relaxed a little bit on some of that. And the safety manual, severe weather, as this was during the time frame of our spring severe weather, we did do some updates to our especially our tornado policy and updates to our safety zones. So where our staff go during a tornado, we have a couple of zones within the facility. That way we know where our staff are. If something were to happen, we're able to account for them. And obviously patients, et cetera, go to those same areas. That's all I have. This was all went through the Joint Conference Committee, and we do have Kelly and Rick used to be on that. I think Mike will be on it now. It was approved through the committee, then it goes to the full medical staff. The medical staff approved all the policies and procedures as presented, so then we do bring it to the board for approval.
Okay, hearing Karen's update, could we get a motion on the approval of the Joint Conference Committee policy and procedure revisions?
So moved.
Thank you, Jim. A second, please.
I'll second.
Thank you. All in favor?
Aye.
Thank you.
All right, Mr. Zimmerman.
The Personnel Committee met this morning at 7 o'clock, and we had no initial appointments. We had one initial appointment delegated. We had 3 reappointments and 2 reappointments that were delegated. And I'll make a motion to approve those as presented.
We have a motion, excuse me, for the Personnel Committee report.
I'll second it.
Thank you, Leona. Motion and second. All in favor, please, say aye.
Aye.
Okay, in your packet is the updated board committee appointment sheet. Hopefully you've all had a chance to review that. We had to make some shuffles with the addition of Mike. It would appear that we need an approval on those appointments. If I could get a motion on that, please.
I'll make that motion.
Thank you, Leona. A second, please.
I'll second.
It was tied. We have a motion and a second. All in favor, please say aye.
Aye.
All right. Now we're up to the approval of the Shelby County Medical Corporation Board of Director reappointments. Barry?
So we have 2 hospital trustees that serve on Shelby County Medical Corporation, and they serve for 1-year terms, July 1 through June 30, and the 2 individuals that are serving right now are Terry and Janine. So would like to get approval from the board to appoint them for a 1-year term.
I'll make a motion to approve.
Thank you.
I'll second that motion.
Thank you, Mike. All in favor, say aye.
Aye.
Aye. All right. Barry, I guess we can just move on to the CEO report.
Yeah, so every year we present to the board the contract with Shelby County Medical Corporation. They provide physician services to the hospital. So all of our family practice physicians, podiatry, general surgery, and then we have several contracted physicians that work out of the outpatient physicians clinic that are also contracted through Shelby County Medical Corporation. So we use this work RVU system to determine how to compensate, or how the contract works between the hospital and Shelby County Medical Corporation. And I show this to you every year, basically what an RVU is. It's part of the resource-based relative value system that was developed by Medicare to estimate the resources used to provide services in a medical practice setting. And this is a base or a system that's been used for quite some time to base your physician-based production compensation on. That's been going on for many years. So our current contracted RVU rate is $102. I looked at the budget from last year, and that was going to cost us about $5.4 million during that year. Moving forward, we'd like to move that to $104, and that would be a total estimated cost of $5.6 million. Really, the only changes is we are going to have a change with our general surgeon, so there's some uncertainty as to what that will cost in total. And then we've also added Karen mentioned our neurologist, Dr. Bass. That's been added, as well as we're working with a rheumatologist, Dr. Wilde, and that position would also be contracted through Shelby County Medical Corporation. So those are some of the additions. This also includes not just salary and benefits, but really all the costs associated with running Shelby County Medical Corporation as a business. So there's, dues and malpractice, disability, life, work comp, administrative services. So the work that I do, and Christy and Karen and our quality staff, HR, payroll, accounting. So there's significant costs related to running this other organization. So that's some of the costs that go into that $5.6 million. It isn't just all salary and benefits and contracted services. What was your
I was just
question?
going to ask about malpractice insurance. Has that gone up drastically? I've heard that in the news.
It did just this last year. It's gone
Okay.
up quite a bit.
Okay, so that's part of it.
Yeah.
Yeah.
But we'd like to go up from 102 to 104, so about a 2%, a little less than 2% increase from the previous year. So
Yeah.
I would ask for approval of that.
I'll make the motion to approve that.
Thank you, Jim. I have a motion for the approval of the physician services agreement.
I'll second it.
Thank you, Leona. Motion and a second. All in favor?
Aye.
And then I wanted to present this economic impact report. This is something the Iowa Hospital Association does every year for all the hospitals in the state of Iowa. And I'm going to skip past that one. So this is Shelby County, and we have got the actual numbers here. We've got about 400 actual employees of Myrtue Medical Center, but because we have employees here, because they spend money on gas, food, other items throughout the community, that creates other jobs. So the total jobs that Shelby County, or Myrtue Medical Center creates in Shelby County is 758 jobs, which is about 14% of the jobs in Shelby County. Total wages generated is 36 million, which is about 16% of the wages. And this is salary and benefits in Shelby County, and total expenses that are generated because of the hospital being here is about 78 million, so about 12%. They've kind of included, they used to have a separate economic impact report, separate from community benefits, so they've kind of combined the two. And the community benefits part, this 2.2 million, really just includes charity care, bad debt write-off, and then the dollars that we are in excess, Medicaid dollars that are in excess of what we get reimbursed, or expenses in excess of what we get reimbursed. There's a lot of other community benefit beyond this that is not included here anymore. I mean, there's a lot of services and programs that we provide to the community because they're needed services that we lose money on. So this really, I'm not sure it should even be on this report because it's really not very representative of the true community benefit that we provide. But I wanted to get that in front of you. We use this in our advocacy efforts, really to communicate this kind of information and how important the hospitals are to their communities, especially in the rural areas. So, any questions on that?
It's a huge impact.
Yes,
Yeah.
it is.
Okay, just a few comments on a few things that are going on. Our emergency room group, and that includes myself and Jeff and Drew and Karen and Jenny Lefevre. We've met with the architect for the third time, and Christy's in on that as well. They've given us a couple of high-level kind of options. One is an expansion to the south of the current ED, which is what was in our master facility planning from 3 to 4 years ago. And then there's another one that's an expansion to the north of the existing ER. So we're looking at both of those. Right now, we really want to stay on top of costs. So we are going to have an estimator look at what the cost of both of those options would be. And then we're trying to meet, I think, about every 3 weeks. So we'll get that information back soon. But that's where we're at right now with our ER project.
When do you want to start?
Planning.
When are you looking to start?
Next spring, we'd like to be able to go out for bid, November, December timeframe. And I've talked to you a little bit about the ambulance services and some of those meetings that are ongoing with the various stakeholders. We continue to meet with that group. We did present a hospital-based option to that group. And it's a pretty, I guess in my opinion, it makes the most sense of all the options that we've looked at. But right now, I think EMA is kind of getting some input from the volunteers throughout the county. And so that's kind of where we're at right now. We'll re-meet here probably in the next 2 to 3 weeks and continue those discussions. And I did present that option to the Finance Committee, I believe. We reviewed what that option would look like. So there's more to come on that moving forward. Did want to let you know that we're working with Children's Square on contracting with the psychiatrist. And we've got the contract that we're reviewing and working, making some changes to that, but hopefully we'll have Dr. Walker be on board here the next few months.
Telemedicine, will he come out?
He actually wants to come out. He will be here.
Nice.
We've used Dr. Dean for several years now, and he's really been more telemedicine the last few years.
Will he
And
still
then
do it then too?
What's that?
Sorry to interrupt you. Will he still continue to do it? Dr. Dean?
I think once we get Dr. Walker on board,
Okay.
he will retire. And then I mentioned rheumatology. And then the only other thing I have is we are finalizing our contract with Caravan for our accountable care organization. Again, I think we've talked about that quite a bit in meetings, so I won't spend a lot of time. I'll give you more information on that once we've finalized that agreement. And then I did want Jill to do a little update on our general surgery recruitment, and then after that, I want Jeff to talk about the central utility plant project. So, Jill.
Yeah, so very pleased. We had another couple very good site visits last week with 2 additional general surgeon candidates. They each have several years of experience. Each of them bring more than 25 years. They've each performed in rural settings, rural facilities. They both have quite a broad scope of general surgery experience, and they both have an affinity for the Midwest. They both have ties to the Midwest, have practiced in Minnesota, in Missouri, but also in some locations out east as well. The visits themselves went very well. Barry and I had a chance to round with our medical staff and each of the individuals who participated in those visits, and they were very pleased with what they saw and what they heard. Our CRNAs, nurse anesthetists, were also involved in those conversations because they spend a lot of time in the OR with those individuals. So just a very positive visit. One of them will actually be providing locum coverage for us.
starting on July 11th. So we just look forward to continuing these conversations with these two individuals, and we're in a good position with both right now.
That's great to hear.
Yeah.
It's a tough spot.
Right.
Are the locum people, are they exclusive to our facility then, or are they revolving?
This one will be. We've retained this individual for coverage through the end of September as needed. We have a 30-day agreement where if we hire a full-time in the meantime, we have a 30-day notice to provide.
Is that typically how long it would take to get somebody into that position? Or how long does it take to, once you offer a job to someone, how long does it take to?
Through the credentialing, privileging process, it can take several weeks,
Okay,
8 weeks,
gotcha.
4 to 8. Depends on if they already have an Iowa license. We're fortunate that I believe both of our candidates who we're looking at already have.
Sounds good.
Right, the CUP project, you see a lot of activity going on outside now. Yesterday we poured the second half of the retaining wall. The first half is all backfilled with dirt, so that's a great step there. Today they'll be removing the forms. We have to coordinate with HMU to run a new gas line. Then some more concrete work will be going on inside of the plant around the electrical and the propane tanks. And in talking with the contractor, the concrete contractor, his target is to have everything outside done by the end of next week. So getting some good movement there. A lot of work is going on inside, which isn't very visible, but all of our boilers are placed, they're being plumbed. The challenge right now is the exhaust right up straight above where we need to exhaust. There's some conduits that are scheduled to be moved so we can get the exhaust up through the roof. Holes are already drilled, they're plumbed up on the roof, so it's just a matter of connecting there. We have 4 humidifiers that are in place. They're being hooked up, and the target is to have those up and running this week. We also have some steam generators that are placed and plumbing all those, connecting those, and their target is to be the end of next week to have those all up and operational. Hot water heaters are set, and to get those operational, we have to run piping through the ED and down the hallway to the maintenance area. There's a boiler room back there. So that is scheduled this week and early next week to get that taken care of. So we'll see some work in the hallways coming up shortly. Today, on the inside of the utility plant is a set of steps that need to be put in there. Right now, they're all kind of using a ladder or jumping down. Not real safe, but as part of the project is a set of stairs. Those will be in place and by the end of today. Once we have 2 boilers and the hot water heaters hooked up, we feel they're confident that they can shut the old boiler off and start removing it. And then we have to clear out some concrete pads that are currently in there, re-pour a new pad, and that air handler that is sitting outside on the south side will be dismantled and put on the inside. So a lot of activity going on. Do you have any questions?
Sounds like a lot of work for August completion, did you say?
Yeah, but they feel that everything will be up and operational by then. There'll be some cosmetic things, some dirt work, and a few others. Removing some pipes, the abandoned pipes that will need to come out of there. So
Can they work on the outside, addressing the lack of eye-pleasing?
yes, we have brought that up, and I continue to bring it up with the contractor. And he says, "Well, I weed whacked." It's like you go out there. He did about a space like this on the north side, but the weeds there. I'll reiterate that he needs to take care of the weeds.
First thing I noticed when I turned the corner, I thought, oh.
Yep.
But it can be done before the inside's done, I guess.
Yeah, it's done
A question.
simultaneously. Yeah,
Okay.
it's a different crew that's working outside, and the labor for the upkeep there is something that they hire through a service in Des Moines, the day labor type activities. So
It's nice
Okay.
to see the activity outside.
Yes.
Because that's what people see.
Yeah.
Yep.
Okay.
Yeah, it's nice to see it
Yeah, you're right. It did
Yeah.
sit for a while.
moving. Yep. Thanks for the updates, guys.
Yep.
That's all.
Not back to you? Okay. All right, we're moving on to the approval of the capital purchase. Jill?
All right, well, I have the pleasure of sharing some very positive news with
Yay.
everyone. We have received support from our community and those who share Myrtue's commitment to wellness in Shelby County. And this, what you're seeing right here is a very generous contribution totaling $336,099 that was directed to the Peterson Family Wellness Center and the Lewis Family Aquatic Complex during our Make a Splash campaign that took place in the last year. And this includes donations from about 137 unique individuals and businesses who donated to our campaign throughout the year. We kicked off this fundraiser in May, so just a little over a year ago. We had a goal at that time to resurface the pool floor as well as replace several pieces of equipment. And with contributions from the community, we were able to start that resurfacing project last November, and it lasted about a month's time, and we were able to reopen the pool on December 15th. We are currently preparing to install 2 pool lift chairs. So those are ADA compliant chairs that lift and raise individuals in and out of the pool. That is a little bit more of a delicate process because it involves drilling and the depth that you need to secure those chairs on the pool deck floor. So we are working carefully with the vendor who is going to be installing those chairs. We don't want to disrupt anything with the pool membrane. So that's just a delicate process, but we do anticipate that those will be installed yet this summer. The equipment replacement, this is our current need, and will take about 12 to 14 weeks. This was part of the ask of the campaign, is that we fund for the replacement of several pieces of equipment. And that's what I'll be sharing a little bit more detail with you. And our donor wall project, so this is very important to us. We recognize those individuals who generously contributed to the effort to sustain this amenity in our community, and so we will be working on a donor wall project this fall to recognize all of those individuals. Our goal, we want to continue to be the wellness facility of choice for the people of Shelby County and our surrounding areas, and to draw people to Shelby County who are looking to this area to call home. So we are in need of replacing several pieces of equipment that have more than 11 years of repetitive use. Some are showing those signs of degrading, and they're no longer in peak performance. Many of our pieces of equipment, in particular the cardio that you see on the first line, they have more than 50,000 miles of use, which is pretty amazing. The Wellness Center, we average over 100,000 visits per year by our members, guests, and visitors, and we currently have more than almost 3,600 members at this time. So by replacing the equipment with more high-quality equipment, we'll continue to engage our community and members of all ages to continue to use the facility. It also supports Myrtue's Live Well program. So this is offered through our Rehab Services Department. So once individuals graduate from rehab, they're able to move to more self-sustaining wellness activities using our equipment in the Wellness Center. So you can see how the price breakdown goes here. This line of equipment is not inexpensive by any means. So we have a total there of 38 pieces of equipment totaling $177,811. And this also includes the shipping and handling, the delivery and installation. That's also a delicate process because of the weight and we don't want to do any damage to our current facility floor.
What do you do with the old stuff?
So we would like to offer the donation of used equipment. So, we're very much closely aligned with Shelby County Health Foundation, and some of our board members had brought that up, that we would like to see some of this equipment that's still in very good use to be distributed throughout the community. So Todd and I have actually already reached out to a couple of other nonprofit entities who could also benefit from that. But we're opening that up today to the community, any other nonprofits to contact Todd by July 15th to make arrangements for that. Any undonated to nonprofits, the vendor of choice that I'll show you, they will extract all of the equipment. It's part of our purchase price. And they know what they're doing. They do that in a very safe and careful manner. So in total, you saw how much we earned throughout the Make a Splash campaign. We still do have $20,000 in pledges outstanding that we anticipate receiving by the end of this year. So that leaves us with available funds of $316,099. We have already paid and covered the pool resurfacing costs of $107,415. So the Wellness Center does have funds remaining of $208,684 from the campaign. So today's request is to purchase the equipment that I had outlined through Nova Fitness Equipment for $177,811. They are our current vendor of choice. We utilize them currently and have a very good relationship with them. At the time of order placement, it will take 12 to 14, that's weeks. That's weeks. 12 to 14 weeks lead time on production and delivery.
Do they guarantee any of that equipment?
There is a warranty. Most equipment is the same, but it's a 1-year warranty on parts and labor. And then, kind of after that, we try to get our maintenance man to get certified in that equipment, so he takes care of it himself.
When you offer the old equipment to the community and nonprofits, we are not liable for any equipment that somebody might fall or whatever, we're done. We give it to them, how does that work?
Yeah, Todd and I discussed that, and we will have to generate an agreement. Yes.
This is aside from the purchase, and I feel somewhat ignorant. Does our physical therapy use the pool as a part of physical therapy?
No, they're not really using it right now. I think they maybe use more of the...
Yeah, they use more of the equipment. They have their own pool that they do their aquatic exercise in. They do come over once, I would say once every 6 months. They might bring somebody over that has needing some ideas in there, but they usually utilize the Live Well person if they need somebody to work in our pool. So it's kind of after they graduate from cardiac or from physical therapy that they send them on to the Live Well person to take care of them in the pool.
So the chairlifts are specifically for the community, not...
Correct.
Okay.
Correct.
Okay.
Yeah, physical therapy has their own chairlift in their pool.
All right.
So basically those chairlifts, one is for the pool and one is for the spa. You have to have 2 separate ones if you need one for the spa. You can't use the same one.
Sure. Okay.
You done? I am done. Well, I do need a motion to approve the purchase.
All right, we have heard Jill's information. If I could get a motion on the approval of the capital purchase for the equipment.
I'll do the motion to purchase 177,811 from Nova Fitness for replacement equipment.
Thank you, Mike. Second, please.
I'll second it.
Jim. All in favor, say aye.
Thank you.
Motion carries. All right, Christie. Approval of the resolution naming depositories.
Okay, so Iowa code requires us to have a resolution naming the maximum amount of funds we'll have available in our financial institution, which we've had that in place, and but we want to add Intrify Network to that. It's a association that Shelby County State Bank has with another organization that basically has the ability to place funds in multiple different banks that keeps it under the $250,000 FDIC limit. So we would just like to add them for another option they can give us a little bit higher rate on the CD at this point in time. So I set their limit at the $6 million, which is comparable to all of the other financial institutions that we have CDs in at this point in time. Defiance and Farmers Trust and Savings are set at $1 million. Our Iowa Public Agency Investment Trust is $6 million. New York Life, which is a mutual fund, is $6 million. Mid-States, who is our main checking account, is $25 million. Shelby County State Bank is $6 million. Town Country is $1 million. United Bank of Iowa and then Intrafi is all both at $6 million. So those are our depository resolutions. Any questions on that?
I'm going to abstain.
I could get a motion to accept Intrafi for $6 million, was it, Christie? As a naming depository.
I'll make that motion.
Thank you. Second, please. Thanks, Mike. Motion and second. All in favor, say aye.
Aye.
All right, motion passes. Mileage rate increase July 1st, obviously.
Yes, so the IRS generally changes mileage rate at the first of the year every year. Due to the economic impact of the price of fuel, they've decided to do another standard mileage reimbursement increase as of July 1st. So the business mileage, which is what our policy allows us to reimburse to our staff members have to use personal vehicles, will increase 4 cents from 58.5 to 62.1 cents, or 62.5 cents per mile. If you've got moving or medical or moving mileage, it went from 18 cents to 22 cents. They did leave charitable contribution mileage at 14 cents, that's by statute. So we need a motion just to increase our mileage reimbursement per policy to the IRS rates.
What is the medical moving with that?
So if you have to drive to a medical facility in Omaha, for instance, or Des
like a
Moines or
patient.
Iowa City,
Okay.
yes,
Not anyone from here, though?
correct.
Gotcha.
So if you personally want to, if you can claim that on your own personal tax
Taxes.
returns,
Gotcha.
you can document that and get that deduction there.
I'll make a motion to approve the increase effective July.
Thank you, Jim. We have a motion. Second, please.
I'll second it.
Thank you, Leona. Motion and second. All in favor for the increase in the mileage rate? Say aye.
Aye.
Okay, Christie, moving on, the approval of the monthly financial statements.
Okay, so for the month of May of 2020, we had over 6,000 outpatient visits, 435 visits to our ER, 132 surgical procedures, inpatient and outpatient, 3,198 real health clinic visits. Our average daily census between acute, OB, hospice, swing bed, and our observation patients is 9.17. We did have 6 births in the month of May. So our net income from operations was a loss this month of about $59,000. Other operating was $21,000, so we had a loss from all operations this month of almost $38,000. Year to date, we're sitting from all sources of $3.1 million in revenue, our net income. And last year we were at 5.2, and the majority of that change there is because of stimulus money. I do want to point out that our births are up almost 61% from this time last year. So for year to date, we are at 74 compared to 46 last year. So a significant increase in our births. So that's good. Almost all of our services have seen an increase this year. Still down a little bit in surgical procedures. Have wanted to give you a little bit of history since kind of see the impact of COVID, where we've been the last 4 years. So as you can see, we're continuing to increase significantly in our outpatient behavioral health visits. In 2019, we're at almost 56,000 for the 11 months, and this year we're at almost 65,000. So significant increases in those services. ER visits We were at 5,000 before the pandemic, dipped down. That was the biggest department, that and surgical, that we did see declines in. But we are back up to 5,200, so still an increase there over the last 4 years. Surgical procedures, as I said, we were 1,473 back in 19, dipped down and really we haven't fully come back, but we're pretty close at 1,326. Physician clinic visits, we are just really about right there again. We were at 42,000 prior to in 2019, and we're almost at 41,600 this year, 41,600. Inpatient, our average daily census is down a little bit from still, which that has consistently gone down year to year as we struggle with swing beds going down and now observation patients. Insurance companies just do not want patients in the hospital if at all can help. Births, again, like I said, we were at 53 in 19. In 20, we were up at 67. Down in 2021 is 46 and up to 74 this year. And you can see there in 19, we had a $1.1 million net income from all sources, and in 2020 we had 3.9. 2021 we were at 5.2, and we're at 3.1 this year so far. Any questions on the financial reports? Cash flow's doing good. AR is remaining consistent. Our cash balance is remaining consistent. So financially, we are still maintaining a strong financial statement. And you have
Questions?
Details in the packet.
I'll make a motion to approve the financials for me.
Thank you. We have a motion from Jim to approve the monthly financial statements. If we could get a second, please.
I'll second that.
Thank you, Mike. Motion and second. All in favor, please say aye.
Aye.
Okay, Christie, I guess you get to keep moving.
The approval of the payroll and claims, were there any questions? I had none in advance on the list of payroll and claims, pretty consistent.
Hearing none, we need to hear, I have a motion on the approval of payroll and claims for May of this year.
I'll make that motion.
Thank you, Mike. I have a motion, second, please.
I'll second that motion.
Thank you, Leona. Motion and second, all in favor?
Aye.
And we're up to the approval of the operating and capital budgets for the coming fiscal year.
Okay, so we met with the finance committee, Barry and I met with the finance committee on the 15th of June. Basically for the operating budget, we are still rebounding, of course, and growing now from COVID. So in fiscal year 2022, we're still rebounding. Fiscal 23, we're hoping to see our services continue. As Barry mentioned, we're looking at rheumatology, neurology, some other services. We do see a significant increase in our cost for next year. Medications are expected drugs are expected to go up at least 15%. Medical supplies are still going up at about 8%. So we do have a significant increase in our cost. Unfortunately, we have to pass those on to the patient, so we will see some increases in the cost of services. So next year we are looking at seeing an operating revenue. This year we are projected to be at $49 million. We're looking at a 9.3% increase from all operating revenue up to close at $54 million for next year. Operating expenses, which includes any increases in our professional services, as Barry had mentioned, in our Shelby County Medical Corp, any of our other professional services contracts that we have on maintenance of our equipment, service contracts for Epic, for other multiple different services that we provide we need for giving patient care. Increases in wages and benefits for the next year, depreciation, all those different expenses we went through in detail with the finance committee, is going up to about $54 million also, so a 9.6% increase. Gets us to about a break even, a little bit above a break even from operations. Our non-operating revenue, which is our property taxes, which remain the same as they have for fiscal year 22, for fiscal year '23. Return on investment, some other miscellaneous non-operating grants that are in there. So we are seeing from net income from operations of 1.7 million for next year. We'll look at IHA surveys for wages and benefit increases for this next year when that comes out in October for the January 1st. So any questions on the operating budget?
Questions?
A lot of time spent doing that.
Yes.
Yeah, we meet with every department manager has an opportunity to look at their budget, have input. I meet with them and go through any new requests, any changes. We also meet with them every quarter so that it's not really a surprise and they really understand their budgets and finances a lot better. To look at the capital budget, we asked the staff to go through and look at end-of-life equipment every year. We project out for 3 years as to what's going to be needed in the next 3 years. So we took a look at that. Last year we'd asked for $2 million. We will be close to that for spending this year with all the different projects that we have on. There is a significant amount of carryover, that things that you guys have approved and they've been ordered, but they're not going to come into next year, but we take them out of this year's budget. So there is a significant amount of that lag in time of ordering. But what everybody, all the managers and we determined to be kind of the priorities for this next year is just a little over $2 million. So we're going to hold it at a request for $2 million. And that does not include any kind of like our CUP project, our ER project, those large capital projects that we have going on. So we would like to have approval for $2 million for capital budget for this next fiscal year also.
Do you want a motion for both budgets? Okay, if we could get the approval for both the operating and the capital budgets for the next fiscal year, please. Need a motion? Thank you, Mike. Second, please.
I'll second.
Motion and a second. All in favor, please say aye.
Aye.
And that brings us to the end of the meeting. Before we adjourn, we had talked about not having a meeting in July. Is that we're leaving it there just in case?
Yeah, I think we need to leave it there.
Okay.
I think it's likely we will need to have
Oh,
a meeting.
all right, I didn't
But
know.
we'll make that decision.
Right,
A little
okay.
later.
All right, if I could have a motion for adjournment then, please?
So moved.
So moved. Second. We are adjourned.